It's the summer. That means no more school and lots of fun in the sun. It also means sunburns. Here at Highland Pediatrics, we want to help you take care of your child every part of this season. And part of that is keeping them safe from the sun. Sunburns happen because of too much exposure to the sun. And they're sneaky because you don't even know it's happening. There's no warning sign. You don't even know it's happened until 4 hours after exposure. That's when the pain and the redness and the swelling are going to start. Now, that's going to keep on going and peak at 24 hours, and they don't stop feeling better until after 48 hours. That's 2 miserable days for your child and for you. So we're going to teach you how to treat sunburns, but more importantly, how to prevent them. There are 3 different degrees to a sunburn. Your 1st degree sunburn will be the pink or the red that you'll see on the skin. 2nd degree sunburns will blister, and 3rd degree sunburns get even deeper into the skin and can cause scarring. While these are rare, we do want to make sure that you avoid that as best as possible. And you don't have to be in direct sunlight to get burned. The sun's rays can be reflected, and UV light still gets through on cloudy days. As a matter of fact, 70% of UV light is still getting through even on a cloudy day. 80% of sunlight is reflected from snow, 20% is reflected from sand, and 5% is reflected from water. So what do? Easy. Use sunscreen. And you want to use a sunscreen with an SPF of 15 or higher. 30 if you have a fair-skinned child, especially if they're blonde or red-headed. You want to put that on 30 minutes before sun exposure to give it time to get down into the skin. Pay attention to the nose, the ears, the cheeks, and the shoulders. You can try a sunscreen stick there. Reapply every 3 to 4 hours, unless they're in water. Waterproof sunscreen only lasts for 30 minutes, so if your child's in water, you need to apply that every 30 minutes in order for it to work. Now, if you have a baby under 6 months of age, best practice is not to have them in the sun at all. Keep them always in the shade. If your child is 6 months to 3 years of age, sun avoidance is still the best practice, or at least sunproof clothing with long sleeves and long pants to protect those arms and legs. And you want to wear a hat that has a 3-inch brim around it to protect their face and the skin up above. Now, while the FDA has not approved for the use of sunscreen on children under 6 months of age, the American Academy of Pediatrics does support it. So if needed, and it's not possible to avoid the sun with babies under the age of 6 months, you can apply some sunscreen, but you want to apply it on small areas, and you want to be very careful around the eyes of all your children. If they happen to rub the sunscreen into their eyes, they're going to get pretty irritated and teary. You'll want to take a damp cloth to wipe away everything from the eyes and wash it off the hands at the same time. Lips can get sunburned too, so get a chapstick that has sunscreen in it, and wear good sunglasses to protect those eyes. Actually, that may help to prevent cataracts in the future. Avoid being out in the sun between 10 a.m. and 3 p.m. if you can. That's when the sun is highest in the sky, and that's when its rays are the strongest. Now, how do you treat a sunburn? First of all, as soon as you realize that your child has been burned, start giving them ibuprofen as soon as possible. Starting ibuprofen within 6 hours of a sunburn helps to reduce the pain and the swelling that you will see. You want to give that for 2 days. If your child is 6 months or younger though, under 6 months should not have ibuprofen. It is not approved and it can be dangerous. You also want to start hydrocortisone 1% cream as soon as possible. Use this 3 times a day for 2 days. Using this may also decrease the swelling and the pain. If you don't have any on hand, you can use moisturizing cream or aloe vera until you can get some. And you can pick that up from anywhere over the counter. Do not use ointments. Ointments will actually block the sweat glands and cause more pain. If your child is still having pain, you can use some cool wet cloths to the areas that are burned. If they have a larger part of their body burned, sitting them in a cool bath for 10 minutes will help, but be careful not to let them shiver. Shivering actually will cause a fever. Make sure they're drinking lots of water on that first day. Extra water is important to avoid dehydration as well as dizziness. If your child has blisters, don't pop them. Let the body do its job. However, if they do pop on their own, you can trim away the dead skin with scissors that you've cleaned with rubbing alcohol. If your child has large open blisters, you can apply antibiotic ointment to those areas twice a day for 3 days to avoid infection. Remember, it's going to take 2 to 3 days for the pain to resolve. After that, you're going to get lots of itching. And about 5 to 7 days after is when you see the peeling. As always, we here at Highland PD are available to answer any question or just to give you more advice. You can definitely give our office a call, speak with a triage nurse if you have any questions about sunburns or if you have any concerns. We're always here to help you. So, enjoy your summer, stay cool, and stay healthy.